Hello everyone, I'm Atif Ahmed, an active member of Pharma Media LLP. I'm delighted to be your host for episode 1 of our podcast series where we explore inspiring journeys and emerging career pathways in pharmacy and healthcare. Pharma Media LLP is a digital healthcare and life sciences media platform dedicated to bridging the gap between education, research, and industry through podcast, educational initiatives, and industry focused engagements. We aim to empower healthcare and pharmaceutical professionals with practical insights, real world exposure, and meaningful global connections. Today, we are honored to welcome Dr. Vandana Garg, a distinguished medical affairs and innovation leader with over 16 years of experience across clinical practice, pharma, and global healthcare leadership. She is currently serving in medical and scientific affair lead for Southeast Asia and Taiwan at Haleon, where she leads medical strategy across 11 countries and works with leading OTC brands such as Panadol, Voltaren, Advil, and Otrivin. Dr. Gar holds an MBBS from Government Medical College, Kozhikode, an MBA in Finance and Marketing from Tapmi Institute, Manipal, and an advanced postgraduate diploma in Clinical Research and Medical Writing from James Lind Institute. Her journey truly reflects how doctors can create far beyond clinical practice. Dr. Vandana, it's an absolute pleasure to have you with us.
Thank you, Atifa. Thanks for having me here.
Thank you. Ma'am, before we begin with our questions, we'd love to hear in your own words, how is your journey? What inspired you to explore roles beyond the clinic?
Okay, awesome. So hello, everyone, whoever is hearing this podcast. So my name is Vandana. I'm based in Singapore, and currently I'm the Medical and Scientific Affairs Director at Haleon. And I'm handling the brands like Centrum, Caltrate, Sensodyne, Panadol, Voltaren, and Otrivin. So I come from a family of doctors. Everyone around me, I mean, when I was growing up, I have just seen one career around me, which was to become a doctor. And somehow I was more curious. I was like, do I also need to follow the path? Is this the only path which I also follow? But I didn't know that what else to do, because at that time, like 25 years back, there were not much options. There was no internet. There was no mentors. I just knew that I wanted to make a bigger impact in my own unique way, but I had no idea what should I do. But again, that the one thing I was sure was that, yes, it has to be an impact, but in a bigger way. So that's where I started. I started exploring things on my own. I did MBBS again because that was the right option at that time. Because I had no, other option or no other guidance that what else to do. But even after completing my MBBS, I was like, okay, I think clinical is not my thing. I cannot sit in the clinics for 24/7 and make an impact by seeing one after one patient. What's bigger? That's what I was exploring. And that's where, after exploring a bit, after talking to people, I decided on to do an MBA. And that's where my journey started. My first role was with Dr. Reddy's it was a medical marketing role, which was a mix of marketing and medical affairs. And after that, I never looked back. Again, I would say that it was not a vertical journey. It was not a very smooth journey because I was still figuring out what to do, what else to do. And again, talking about 2 decades back, the industry was also not very open to have healthcare professionals into many roles. That was not really the trend, unlike today. So I kept figuring out, I kept saying yes to those uncomfortable opportunities, kept learning and kept choosing my path. And that's where I am today, a very well-established medical affairs leader. And I would say, even though the journey was not smooth, it was a beautiful journey. I learned a lot. And then I think today I can say that I'm making an impact, what I wanted to do. Maybe 16 years back, I didn't have that answer, but today I have that answer that, okay, this is what I wanted to do.
Okay. Nice. Was there a particular moment or experience that made you realize healthcare impact extends far beyond the clinical or hospital setting?
Mm, not exactly any one moment, I would say, but there were like moments, as I said, growing up, I've just seen that how hardworking my parents or all the doctors in my family were. So they were like literally working uh, 20 hours a day, and then making an impact, of course, but like one patient after one patient. So I was like, is there anything where healthcare professionals or doctors can make a bigger impact, which is more scaled up, which is more sustainable? So I think those multiple moments led me to this place where I'm today, and I would not say there was any one aha moment like that.
Okay. Next, why do you think many doctors still perceive non-clinical careers as unconventional or risky?
Uh, Mostly because we don't hear enough about them when we are getting trained in the medical schools. In medical school, we are taught that clinical practice is the only path, right? So once you finish your degree, once you finish your post graduation, and then you just choose the clinical path. So anything else feels like stepping into an unknown world. And another thing is that there's also a fear of losing your identity as a doctor. Like many of my mentees tell me this, that if they move into a non-clinical field, they might lose their identity as a doctor, which is a wrong perception, which is not true. So these non-clinical roles as well still use your medical knowledge every day and give you enough identity. I would say more identity to make that impact.
Okay. How would you redefine success for doctors who choose career paths beyond direct patient care?
Uh, okay, so see, success, as in at any other field, right, is not just about the number of patients you see. It's ultimately about the impact you create. So if you're making an impact from a different place, for example, by improving health policies, by educating the communities, or by driving healthcare innovation, I would say that's success too, right? It's just that it's making a difference on a bigger scale. So that's how I will say that, if you're asking me how to redefine success, in the non-clinical field. So that's what I would say, that you are creating that impact for the patients, for the community, but at a bigger scale.
Okay. Based on your experience, what does true influence means within the pharma and healthcare ecosystem?
Mm, okay, again, influence isn't only about job titles, right? So I would say that I'm a director in medical affairs, but that might not mean anything to anyone or even myself, right? It's just a title. So when it comes to the real influence or the true influence, it's all about trust and doing the right things. So it means you're using your scientific expertise, your medical expertise to guide the decisions that are ultimately helping the patients or even the caregivers or the broader communities. So when people trust your advice because it's ethical and evidence based, because you're a healthcare professional, that's the real influence, I would say.
Okay. How can doctors effectively leverage the medical training to become credible and trusted voices in pharma, policymaking, and public health?
Uh, I would say that our medical background or our healthcare background anyways gives us the credibility, right? So that credibility is there because you have trained for so many years in that field. Now, the key here in pharma or the industry is to explain that complex healthcare science in a way that people or patients understand. Uh, and it's not only people and patients, right? It can be policymakers, regulators, industry leaders, or even general public. And that's where you are keeping your patient's perspective at the center. So basically, you're still serving the patients, the consumers. That's the center of everything. But then you're using your healthcare training or your medical background as a credibility. And that gives you the trusted votes.
Okay. In today's information heavy environment, what role does evidence based communication play in combating medical information misinformations?
I would say it's absolutely critical. And it's a very good question.
Yeah.
Thanks for asking. Because there's so much of misinformation out there, especially in the healthcare field, right? So, again, I'm not targeting any particular group, but I see that, you know, the social media is full of so-called nutritionists, health coaches, you know, fitness coaches, and then there's so much of information that the general public is so confused that whom to believe, right? So sometimes they just go with the flow or go with the person who looks more attractive or who give you the things or information in a more attractive way, right? But somewhere then we are missing that clear, simple, factual information which the general public doesn't realize. So as doctors or any healthcare professionals, we can make that science easy to understand without losing its accuracy. So that's what I would say. And that's how we build trust and that combat that misinformation.
Okay. Medical affair is often described as a bridge between science and business. How crucial is this function in shaping patient outcomes and ethical decision making?
I think you put it very correctly that it's a link or a bridge between science and business. In fact, you know, it's not a joke, but then until now, people call medical affairs as a support function or even a policeman function, where that, you know, people think that once you go to a medical affairs professional, they will just say no to things, right? Because when you are in industry and when you are into medical affairs, you always have to balance the things, the science part of the thing, the regulation part and the business part, right? So you can't just keep saying that, okay, this is the science, you can't do this, you can't do this, you can't do that, right? So there has to be a balance between the science and business. And medical affairs professionals are the ones who make sure that decisions are based on evidence, because that's how they are trained and not just profit, right? So they have to see both the sides of it. So by educating doctors and supporting research, medical affairs actually helps patients get better care. And I would say it's really a role that matters, you know, when it comes to merging the science and the strategy part of things.
Okay. What key skills should clinicians initially develop if they aspire to enter medical affairs, strategy, or leadership roles within healthcare?
I would not say that they have to develop these skills from scratch. See, I mean, during our healthcare training, during our medical training, these skill sets are already with us. It's just that how do we polish them further so that they become more industry appropriate. So some of these skills, again, I always tell my mentees, first is better communication, right? How do we learn to communicate well? Because in an industry, we need to communicate with multiple stakeholders, in internal teams like our cross-functional teams, commercial, regulatory teams, and other teams. And then externally with the doctors, with the healthcare professionals, with the policymakers, with the regulators. So if we don't communicate well, that message is lost. And as I said, that this is not a new skill, right? During our medical training, we were communicating well, or communicating always with, you know, patients, with senior doctors, with caregivers and everything. So that skill is already there. It's just that how do we polish it, or how do we make it industry appropriate? Another skill would be, I would say, is think strategically, because again, as I said, roles like medical affairs are sitting at the intersection of science and business. So that strategical thinking becomes very, very important. And of course, how do you translate the complex scientific data into an easy data or actionable insights, you know, which are easy for other functions to understand, for example, marketing, regulatory, or even the policymakers. So these are few of the skills which help you succeed outside the clinic, or at least when you step out of the clinic for your entry-level role or the first few roles. And after that, of course, you keep learning, you keep developing multiple more skills, whatever is required by the industry or your role.
Okay. What are the most important mindset shifts doctors must make when transitioning into non-clinical or leadership roles?
Again, this is a very good question. So I would say, you know, keep a positive and flexible mindset. That's very, very important, because many of the healthcare professionals tell me, we don't know how to, you know, we are not sure whether we'll be able to do it. So you have, of course, the two worlds are different. The working in a hospital, working in an industry, they are two different worlds. So you have to be flexible, you have to be agile, you have to keep that positive mindset. You also need to get comfortable with the change, because unlike in hospitals, industry moves fast and you'll often work in new areas, every other day. So it's exciting, but a little bit different from clinical practice. So to channel through all this, I would say that, a positive mindset really, really helps.
Okay. What common mistakes do you see clinicians making when exploring careers in pharma or the healthcare industry?
The one common mistake I always see is searching blind. That, we are jumping in without learning about the role or building skills. I see so much of desperation that I want to enter the industry, I want to leave the clinics, but then randomly they're applying everywhere, right? Or randomly they perceive that, okay, I know science part of it, I can write well, so I can become a medical writer. But it doesn't work like that. So I would say that, do your search, connect to people, network, reach out to people who are into these roles, ask them what's needed, what's not needed, right? How can you properly channel your search? So don't jump in without learning, or don't jump in blind. Another mistake, as I mentioned before, is about the skills, right? So sometimes we ignore that we already have those skills inside us. For example, communication, leadership, but in industry, they become even more important, right? So, and the third one, again, this is coming from many of my mentees, where they think that pharma or any industry is less noble. And because that's how we have grown up, that's how we have been trained, right? So that doctor is the most noble profession. So somewhere again they fear that, oh, I'll lose my identity. So that's where there's something inside them which keeps them holding back without searching for the roles properly or with an open mindset. So you have to go with a positive mindset and realize that these roles have huge impact on health. It's not that you are working as a doctor, but you are still making a huge impact on a broader population.
Okay. You are known for simplifying complex science for diverse audiences. How important is personal branding and platforms like LinkedIn for doctors today?
Very, very important. Again, not for doctors, but for any other profession, right? So if people don't know what you stand for, they can't connect with you. So you need to share your thoughts, your learnings, and not just your achievements, right? It helps you build credibility and open doors. Like, we are doing this podcast today, so that's how you know me. So that's why I would say that personal branding, but in a right way. It's not that you're just sharing that I got this certificate, I did this, but so that people see that you are an industry leader, you really understand your topic well. So I would say it's very, very important, and it's tied back to your misinformation question before. So once you build that credibility, once people know that what you stand for, automatically that brings the credibility, and people will go to you that, okay, go to this person, and this person will give you the correct health advice or health information.
Okay. Can a strong digital presence genuinely translate into real-world professional influence and career opportunities?
Definitely, because if you're consistent and authentic, as I said above, it leads to, of course, it makes a real influence on the people you are serving, on your patients, on your consumers, right? When people feel that you are giving a consistent and authentic message, of course they'll follow you. They'll learn from you, they'll follow your advice. So that's the real influence you're making. But on a personal side, of course, it also leads to more collaborations, more speaking opportunities. Like my own journey with Beyond the Clinic started online, and I believe I'm making a real world impact by helping other healthcare professionals step out of the clinical world.
What practical steps can medical students or early career doctors today take to keep non-clinical career options open?
Again, if someone has decided that they would like to explore non-clinical careers beyond clinical careers, because not everyone wants to do that, then start exploring early, right? Ask for internships, even if they are free internships. Ask for freelancing projects. Network in a proper way, okay, not randomly saying hi hello to everyone on LinkedIn and then disappearing. Learn about health policies, learn about what's happening around the world, and in the healthcare communication field. Build skills like data analysis, strategic thinking, stakeholder management, as I was telling before. These skill sets or these things will help you keep doors open without closing the clinical options, right? Don't show that desperation that, okay, now I'm sitting with the MBBS or BDS degree. I hate my job. It's not paying me well. It's not giving me work-life balance. And then show the desperation that, okay, I need to move into a non-clinical field. I would say, please don't do that. So start exploring early, go in a structured way and not in a very random way.
Okay. Informative, very informative. um, if you had to offer one piece of advice to a doctor who feels stuck on certain about the career or is uncertain about the career, basically, what would it be? Like a piece of advice.
Again, I think I've been giving it twice in the above question as well, but I would summarize. So
Yeah.
your healthcare degree or your medical degree is a foundation, okay? It's not a cage. So it's not that you can't move out. It's actually a foundation stone. If you are looking for industry roles, industry also needs you, okay? Don't see it as a one-way channel that only you need an industry job. Industry also needs good healthcare professionals for better innovations, uh, for better health, better communication with healthcare professionals, for better healthcare policies, right? So take one small step at a time. Again, don't go search everything randomly. Talk to someone in the industry, understand what you are going into, right? Because industry roles will not automatically bring more money, more work-life balance. So please understand where you are getting into, right? So action brings clarity. You don't have to figure it all out at once. So take small steps, start early, and believe that your healthcare degree is already a foundation. It's not a waste. And then there's no looking back.
Yeah. What excites you the most about the future role of doctor in pharma and healthcare leadership?
Um, Again, a very critical role, because 2 decades back when I joined the industry, I would see that the non-healthcare professionals were making policies, were contributing to innovation. Of course, that's also needed because we have to see it from a business perspective as well, from a policy aspect as well. But I love that, how more and more healthcare professionals are jumping into such roles, such fields, and giving that evidence-based information to influence innovation, to influence policy making, right? So I would say the way the science, technology, healthcare, everything is coming together, doctors will definitely lead in areas, which really need evidence-based healthcare information like AI, digital health. So it's really a great time to think big, and not that doctors are not needed or healthcare professionals are not needed in future.
Okay. Um, how would you like to see the role of doctors evolve over the next decade beyond traditional clinical practice, like you just said?
Again, I would love to see doctors and even the other healthcare professionals as health leaders, right? So they should not be treating only illnesses in the hospitals, which is more reactive. But I would love to see more and more healthcare professionals coming out and helping in shaping health policies, driving innovation, empowering patients. Our voice really matters in building the future of healthcare. That's what I would say.
Okay. So here we would like to end this. And thank you so much, Dr. Vandana Garg ma'am, for your valuable insights and for sharing your remarkable journey with us today. Your contributions to medical affairs and healthcare innovation have added immense value to this discussion. It was truly an honor to host you.
Thank you so much, Atifa, for having me here.
Thank you, ma'am.
Thank you.
Pharmivon Media, your voice in pharma and healthcare media.